Back in 1996, when pro cyclist Lance Armstrong was battling testicular cancer, he came to Indianapolis for treatment.
And when one of our guests now was facing the same diagnosis in 2022, he was really relieved to understand that Indianapolis is a world-renowned destination for testicular cancer treatment. In honor of National Testicular Cancer Awareness Month, we discussed the city's reputation in this fight and a hope-filled story from one young survivor.
Yeah, welcome to the show, urology expert Dr. Aaron Ludwig and cancer survivor Adam Bassett.
Hi,
Thanks
guys.
for being here.
Well, thank you. Thanks.
This is news to me because, I know Indy has a lot of really great things, but I mean, who would have thought that of all places, this is really the place you want to be if you have to go through this journey, yeah?
Correct. A lot of the algorithm for treatment of testicular cancer, especially more advanced disease, was done at IU. So right here in town.
So, Dr. Ludwig, unlike some of the other cancers we've highlighted on the show, testicular cancer primarily affects younger men. Why is that?
Correct. Yeah. So, it's not entirely known why younger men are affected, but typically men aged 20 to 34 are the more likely to be affected by testicular cancer.
Adam, tell us about your diagnosis. We understand that you brought your symptoms to your primary care provider, and that didn't lead to anything for nearly 10 months, and finally was able to help you need. Tell us about the story.
Yeah, I actually took it to my primary care almost a year before I went and saw Dr. Ludwig, and, medical staff, they're short-staffed and very busy, and so I lived with it for about a year, and something kept telling me that, hey, this is getting worse. You really need to go see a specialist. And I remember just being in Chicago on a Thursday night, and I was just told, get down, see a urologist, and I called, Urology of Indiana on the phone as I'm driving down from Chicago, and they said, well, this doctor, is this available? Don't care, first available appointment, let's get in. Absolutely.
Yeah, I mean, I can't even imagine what was going through your mind. No one wants to have to make these calls.
No, and I always tell this story when I was driving down. Actually, I heard you talk, you talk to Jesus. Well, when you think you have cancer, you start talking to Jesus real fast. And I told Jesus, I said, hey, there's 350 songs on my Spotify. If you play my favorite one before I get to Indianapolis, because I knew it was cancer, I said, I'll accept that it's my time. But it never played, and as soon as I saw Dr. Ludwig, got back in my car, started the car, my favorite song played.
Wow.
Yeah.
I mean, that's Dr. Ludwig, you are with people in some of their scariest moments and also throughout their triumphs. I mean, gosh, what is it like when you have someone like this who's calling you and like, okay, what do we do next? Like, how does that even work?
Sure. Well, that's, certainly in this situation where, somebody comes in with the normal symptoms of testicular cancer, a mass in the testicle, may or may not have pain. The first thing is you want to do an ultrasound to get a better idea of what's going on. And that certainly gives you more information of what you need to do. And then you just take the next steps. If it's suspicious on the ultrasound, we talk about surgery to remove the testicle. And then based on the pathology, then we take the next steps based on that.
Adam, having gone through what you've gone through, and for people who don't know, Adam is the husband of our executive director of guest acquisitions, Taylor
some
Bassett.
Pretty people. Let me tell you something.
They are. They're gorgeous people. You have a gorgeous little boy. When you're going through this, what's going through your mind in that moment? Obviously, having a family like that.
It's rough, and it feels like your life gets frozen. And everything that you thought was important really is no longer important. Like you thought you're thinking about retirement and this and that, and all of a sudden you're like, do I have 6 months? Do I have you don't know. And you kind of watch the whole world just go about their routine, and you feel like you're just stuck. But it was my faith that pulled me through it, and it taught me how to be more patient in life, and honestly just be a better father, better husband.
Dr. Ludwig, what do people need to do? I mean, we're talking about bringing awareness to this. What's the best thing someone can do in this time?
Sure. I think the one thing is certainly doing self-exams. That's probably the one way to potentially detect the testicular tumor at its earliest stage. And then, like Adam, if you feel like something doesn't seem right, go get the appropriate care and kind of keep focusing on getting that appropriate care.
And that's so good to know. And Adam, any people who are looking at this, what's one thing you want them to keep in mind?
Just don't even wait. If something feels off, go see a specialist, go see the right person and get it taken care of.
Thank you guys so much. I got smarter today.
Amazing story, and we're glad you're doing well, and we're thankful you guys are here to talk with us about it, Dave. We appreciate it.
Thank you.